Manual physical therapy techniques and scope of practice. Introduction. Manual therapy can be broadly described as the physical treatment of musculoskeletal illnesses and pain related to them through muscle and joint manipulation and mobilization. It utilizes the application of hands as a therapeutic tool and is often used to modulate pain, eliminate inflammation of soft tissue, facilitate movement, and improve range of motion. Manual therapy can be either an independent therapeutic method or serve as a supplement to other modalities. It is commonly applied in a wide range of disciplines such as physiotherapy, osteopathy, and chiropractic. Sometimes, manual therapy is used by registered nurses who are sometimes required to apply controlled pressure to support prematurely born infants or provide care for the terminally ill. A broad range of manual therapy techniques allows their application to a large variety of medical conditions. Ailments. The therapeutic aims of manual therapy are two-pronged: the repair process and the adaptation process. Conditions such as sore muscles, disc pain, or swollen knees could be treated by directing the repair process of damaged tissues with the application of different manual techniques. It is important to realize that patients with joint stiffness are faced with dysfunctional adaptation processes in their tissues. Manual therapy could be used in such cases for stimulation of proper adaptation that might occur either in the neuromuscular system or in the tissues themselves. For example, a person undergoing a frozen shoulder treatment might experience muscle wasting exacerbated by the lack of proper functioning of the shoulder's motor control. Such a patient has to regain functional motor patterns with the help of manual therapy. Another example that can help illustrate the process of repair and adaptation is the case of chronic trapezius myalgia. It can be regarded as a psychomotor adaptation to psychological stress that has manifested in the shift in normal motor patterns. The altered state of motor function leads to the excessive use of muscles that can result in significant changes in adaptive issues or even muscle damage. Scope of practice. The scope of practice of manual therapy is extremely broad. It approaches every illness from three different dimensions: local, neurological or neuromuscular, and psychological or psychomotor. Therefore, one of the core principles of manual therapy is to approach the repair and adaptation process on a multidimensional level. The dimensional model allows the application of the manual therapy methods in a way that would address the nuances of each specific level. Manual therapy practitioners claim that the following ailments show a favorable response to the application of some of its techniques: pain, allergies, arthritis, cardiovascular disease, temporomandibular disorders, and various injuries, among others. Many postgraduate programs can offer manual therapy education for clinicians. Manual therapy techniques. Manual therapy practitioners perform an assessment of bone and muscle structures as well as the circulation of blood in the damaged tissues to decide on the proper technique for dealing with a condition. Based on their evaluation, they might perform some of the following techniques: soft tissue mobilization, strain counter strain, joint mobilization, muscle energy techniques, and high and low velocity amplitude thrusting. They also encourage patients to perform a set of exercises aimed at the prevention of recurring pain. Individuals wishing to maintain long-term relief from their back pain are especially encouraged to enroll in stretching and strengthening programs. Mobilizations with movement. Mobilizations with movement, MWM, is a set of widely used manual therapy techniques that can be applied to the treatment of patients with musculoskeletal pain. The method, commonly known as Mulligan concept, was developed by physiotherapist Brian Mulligan in 1954. He believed that even insignificant injuries might lead to a positional fault of a joint that might restrain physiological movements. The shape of the articular surfaces and the pull direction of muscles and tendons allow for reducing compressive forces of movement, thus making it unrestricted. The damage in the joint might change the balance provided by proprioceptive feedback and result in muscle stiffness and pain. Such dysfunctions can be treated with the forced mobilization of a joint supported by simultaneous movement generated by the patient. The healthcare specialists with training in the MWM can significantly improve the capacity for movement for individuals who experience various functional restrictions. MWM case study. The randomized controlled and double-blind study conducted by Kachingwe et al. Compared the effectiveness of the MWM technique to other approaches to the treatment of primary shoulder impingement syndrome. 32 participants were randomly assigned to the following groups: exercise with the use of glenohumeral mobilizations, exercise with the MWM method, and control group. Repeated measures analyses showed that the group using MWM and glenohumeral mobilization techniques showed a significant change in pain measured with 3 different scales: VAS, NIR, Hawkins-Kennedy. Myofascial release, MFR. Myofascial release is a therapeutic approach to the treatment of soft tissue restrictions by stimulating relaxation of contracted muscles and unrestricted lymphatic circulation. MFR is concerned with influencing the extremely thin and elastic type of connective tissue that envelopes almost all functional structures in the human body, fascia. According to the osteopathic theory that provides a theoretical framework for MFR, this tissue is highly responsive to external forces. Therefore, under the negative influence of physical or emotional factors, it can harden and lose some of its fluid transportation abilities. Myofascial release therapy specialists argue that the body can retain or memorize some of its postural positions with the help of the microscopic cells containing energy. Trigger point manual therapy. A randomized controlled clinical study conducted by Randomized et al. Explored the effectiveness of trigger point, TRP, manual therapy in the treatment of plantar heel pain in comparison with the self-stretching program. 15 male and 45 female participants with clinically diagnosed plantar heel pain were randomly assigned to one of the 2 groups, the self-stretching group and the self-stretching group who received TRP treatment. The study results showed that the group receiving the TRP protocol reported a higher level of improvement in physical function in comparison to the group receiving only self-stretching therapy. Conclusion. Manual therapy is a physical treatment with an extremely broad scope of application. It utilizes numerous methods and techniques that allow it to be used either independently or in conjunction with other therapeutic practices. It is utilized in a wide range of disciplines such as physiotherapy, osteopathy, and chiropractic. The effectiveness of manual therapy has been confirmed by numerous studies.